In this video, our subject is assisting with urinary and bowel elimination. We will discuss getting ready, how to assist with bedpans, how to assist a man with a urinal, how to care for a person with an indwelling catheter, how to measure urine output, incontinence, ostomy care, and finishing up. The elimination of waste from the body is a basic human need. The two primary ways that the body rids itself of waste are through the processes of urination and defecation. Some of the people you will care for will have an illness or disability that will make it difficult or impossible for them to manage elimination on their own. In such cases, they will need varying degrees of assistance. For most people, the process of elimination is a very private affair, so requiring your assistance is likely to be very embarrassing for them. As a result, in the procedures we're about to demonstrate, your consideration of the person's privacy is essential. Preparation, that is getting ready to manage your work in a manner that is safe, healthful, and efficient, is key to successful health care. No matter what tasks you'll be performing during your shift, whether those tasks are planned or unanticipated, you will benefit from a routine of careful preparation. Begin each interaction with patients or residents by performing these steps. Wash your hands. Gather all needed supplies. Knock before entering the person's room. Introduce yourself using your name and title and greet the person by name, remembering that a friendly greeting helps establish rapport. Carefully identify the person adhering to your facility's approved method. Explain to the person the procedure you're about to perform and make sure the person understands before you begin. If necessary, show visitors where they can wait outside the room. Provide privacy by closing the door and curtains. As appropriate, drape the person for modesty. And then, throughout the procedure, see to safety using proper body mechanics and following all safety precautions for equipment use and infection control. In some instances, your patients or residents will not be able to get out of bed to go to the bathroom. When this is the case, a bedpan may be used. Women will use a bedpan to eliminate both urine and feces. Men will use a bedpan for eliminating feces and will use a urinal for eliminating urine. Bedpans must be used with extreme care. Otherwise, you can easily bruise or tear the fragile skin of an elderly or disabled person. To assist someone in using a bedpan, begin by washing your hands. Then, gather your supplies. These include gloves, bed protectors, toilet paper, a bedpan, a washcloth, a towel, perineal care supplies if needed, and, if the bed protector will not be used to cover the bedpan, a bedpan cover or paper towels.
Hello, Miss Niall.
Begin by positioning the bed at a comfortable working height to promote good body mechanics. Then, lower the head of the bed so that the bed is flat as tolerated. Make sure the wheels are locked. If the side rails are in use, lower the side rail on the working side of the bed. The side rail on the opposite side of the bed should remain up. Next, put on your gloves. Fan fold the top linens to the foot of the bed. Adjust the person's hospital gown or pajama bottoms as necessary to expose the person's buttocks. Slide the bed protector underneath the person's buttocks. Then place the bedpan. This can be accomplished in either of two ways. Using the first method, ask the person to bend her knees, lift her buttocks slightly, and press her heels into the mattress. Then slide the bedpan underneath the person. Using the second method, help the person to turn onto her side facing away from you. Then place the bedpan against the person's buttocks and help the person to roll back onto it. Different equipment calls for different positioning. A standard bedpan, as demonstrated in this procedure, is positioned like a regular toilet seat with the narrow end pointed toward the foot of the bed. A fracture pan is positioned with the narrow end pointed toward the head of the bed. Next, because most people find it easier to use a bedpan when they are in a sitting position, raise the head of the bed slightly as tolerated. Then, draw the top linens over the person for modesty and warmth. Make sure that the toilet paper and the call light control are within reach. If the side rails are in use, return them to the raised position. If safety permits, leave the room and ask the person to call you when she is finished. Remove and discard your gloves. Wash your hands. And remember to close the door on your way out. Return when the person signals. Remember to knock before entering. Lower the head of the bed as tolerated. Put on a clean pair of gloves. Fan fold the top linens to the foot of the bed. Next, you will remove the bedpan from beneath the person's buttocks. This can be accomplished in either of two ways. Using the first method, ask the person to bend her knees, lift her buttocks slightly, and press her heels into the mattress. Then remove the bedpan and the bed protector. Cover the bedpan with the bed protector. Using the second method, help the person to roll onto her side, facing away from you, while you hold the bedpan securely in place against the mattress to prevent the contents from spilling. Remove the bedpan and the bed protector. Cover the bedpan with the bed protector. If necessary, help the person to use the toilet paper. Then help the person to roll back. Take the covered bedpan to the bathroom where you will store it temporarily in preparation either for measuring or for emptying and cleaning. Remove your gloves and dispose of them in a facility-approved waste container. Wash your hands. Put on a clean pair of gloves. Return to the bedside. Help the person to wash her hands. Make sure the person's perineum is clean and dry. If necessary, provide perineal care. Adjust the person's hospital gown or pajama bottoms to cover the buttocks. Help the person back into a comfortable position. Straighten the bottom linens and draw the top linens over the person. Raise the head of the bed to a comfortable position.
Is that comfortable?
Oh, that's wonderful. Thank you.
Return to the bathroom. If the person is on intake and output or I and O status, measure, then note the color and amount of the urine, and or note the color, size, and consistency of the feces before emptying the contents of the bedpan into the toilet. Gather any soiled linens and place them in the soiled linen hamper. Clean and store the equipment and supplies. Dispose of disposable items. Remove your gloves. Wash your hands. Then complete your finishing up steps as described in the final section of this video. When assisting a patient or resident with defecation, be sure to notify the nurse if you observe any of the following. The stool contains blood or mucus. The stool is black or green. The stool is foul-smelling. There is bleeding from the anus during or after a bowel movement. The person has diarrhea or constipation. The person complains of abdominal pain or the abdomen is swollen, and notify the nurse if the person complains that the feces are painful or difficult to pass. Male patients or residents use urinals to urinate. Urinals can be used with the man lying on his back or his side, sitting in the bed or a chair, or standing up. Many men have difficulty voiding in a lying position and may need to be assisted into a sitting or even a standing position to urinate. To assist a man in using the urinal, begin by washing your hands, then gather your supplies. These include gloves, a urinal, toilet paper, a washcloth, and a towel. Put on your gloves. This person is not able to stand or sit up easily, so he will be using the urinal while lying down. Fan fold the top linens and adjust the person's clothing to expose the penis. If necessary, assist the person in positioning the urinal correctly. Make sure that the toilet paper and the call light control are within reach.
Here's your call light control. Can you reach it? Okay.
Remove and discard your gloves. If safety permits, ask the man to call you when he is finished.
All right, be sure to call me when you're done, okay?
Wash your hands. Then leave the room. Remember to close the door behind you. Return when the person signals. Remember, knock before entering. Put on a clean pair of gloves and prepare to assist the person in washing his hands. Have the man hand you the urinal or remove it if he is unable to hand it to you. Put the lid on the urinal and hang it on the side rail. Then, using a wet washcloth, assist the person with hand washing. If necessary, provide perineal care. Take the urinal to the bathroom.
Okay, I'll be right back.
If the man is on intake and output, I and O status, measure the urine. Note the color, amount, and quality of the urine before emptying the contents of the urinal into the toilet. Then clean and disinfect the urinal according to your facility's policy. Gather any soiled linens and place them in the soiled linen hamper. Clean and store equipment and supplies. Remove your gloves. Wash your hands. Then complete your finishing up steps as described in the final section of this video. While assisting a person with urination, be sure to notify the nurse if you observe any unusual characteristics of the urine, such as the urine is cloudy or contains particles, is an abnormal color, or has an abnormal odor. The person complains of difficult or painful urination, or the person is having frequency, urgency, or both. Due to disability or illness, some of your patients or residents will be unable to urinate using a toilet, bedpan, or urinal. These patients and residents will be catheterized with a urinary catheter called an indwelling urinary catheter. An indwelling urinary catheter is a tube that is inserted into a person's bladder and left there to provide continuous urine drainage. Indwelling urinary catheters are connected by a length of tubing to a urine drainage bag. The urine drains continuously from the bladder through the catheter into the tubing and into the drainage bag. This bag is just one of several types of bags. It features a long length of tubing that allows it to be carried or secured to a bed frame or the back of a wheelchair, as shown here. Note that the bag is kept away from the wheels and at a level that is lower than the person's bladder. With this type of bag, the tubing is secured loosely to the person's body near the insertion site using a catheter strap or, as in this case, adhesive tape. Securing the tubing to the person's body prevents the catheter from being accidentally pulled out during repositioning. In women, the tubing is attached to the thigh. In men, to the thigh or to the lower abdomen. As you can see here, a little bit of slack is left in the tubing to prevent the catheter from pulling against the bladder outlet and the urethral opening. When the person is in bed, make sure a little bit of slack is left in the tubing. Then gently coil the remaining length of tubing and secure it to the bed linens using a plastic clip or safety pin. Coiling the tubing prevents the tubing from becoming bent or kinked, which would stop the free flow of urine into the drainage bag. Coiling the tubing and securing it to the bed linens also keeps the weight of the tubing from pulling against the person's body. In the bed, the drainage bag is secured to the bed frame, never the side rail, again at a level lower than the person's bladder. This prevents old, contaminated urine from running back down the tubing and into the person's bladder, causing an infection. When repositioning a person who has an indwelling catheter, always make sure to unclip the coiled tubing from the linens before beginning the procedure. When you are finished with the procedure, secure the coiled tubing to the linens again. At all times, make sure the person is not lying on the coiled tubing. As a nursing assistant, you will be responsible for providing catheter care for your patients or residents who have urinary catheters. Catheter care involves cleaning the perineal area, especially around the urethra, along with cleaning the catheter tubing that extends outside of the body. Although the catheter helps to keep the bladder empty and the bed linens dry, the presence of the catheter in the urethra provides a portal of entry for bacteria to travel into the bladder and cause an infection. That's why meticulous catheter care that is performed routinely helps to reduce the number of bacteria present and lowers the risk of infection. To assist a person with catheter care, begin by washing your hands. Then, gather your supplies. These include gloves, paper towels, a bed protector, a bath thermometer, wash basin, soap, a bath blanket, washcloths, towels, and, if necessary, clean clothing. Cover the overbed table with paper towels. Then put your supplies on the paper towels.
No.
Begin by positioning the bed at a comfortable working height to promote good body mechanics. Then lower the head of the bed so that the bed is flat as tolerated. Make sure the wheels are locked. Fill the wash basin with warm water 110 to 115 degrees Fahrenheit. Place the wash basin on the overbed table. Put on your gloves. If the side rails are in use, lower the side rail on the working side of the bed. The side rail on the opposite side of the bed should remain up. Next, spread the bath blanket over the top linens and the person. If the person is able, have her hold the bath blanket. If not, tuck the corners under the person's shoulders.
Just hold that tight.
Then, fan fold the top linens to the foot of the bed. Ask the person to bend her knees and open her legs, if possible.
Could you bend your knees and open your legs for me, please?
Then position the bath blanket over the person so that one corner can be wrapped under and around each leg. Lift the corner of the bath blanket that is between the person's legs upward, exposing only the perineal area. Position a bed protector under the person's buttocks to keep the bed linens dry. Now perform perineal care. Form a mitt around your hand with one of the washcloths. Wet the mitt with warm, clean water and apply soap. Separate the labia. Place your washcloth-covered hand at the top of the vulva and stroke downward to the anus. Repeat using a different part of the washcloth each time until the area is clean. Continue by cleaning the catheter tubing, starting at the body and moving outward from the body about 4 inches, using a clean part of the soapy washcloth and soapy water. Hold the catheter near the opening of the urethra. This will help to prevent tugging on the catheter as you clean it. Next, rinse the vulva and perineum thoroughly using your non-soapy washcloth. Then remove the soap from the tubing. Dry the perineal area and catheter tubing thoroughly using a towel. Make sure the catheter tubing is securely taped to the person's leg and check that it is free from kinks. Remove your gloves and dispose of them in a facility-approved waste container. Assist the person into the supine position.
Thank you.
Pull the top linens up to cover the person. Remove the bath blanket.
Can you hold them for me?
Surely.
If necessary, help the person into the clean clothing. If the side rails are in use, return the side rails to the raised position. Raise the head of the bed as the person requests. Gather any soiled linens and place them in the soiled linen hamper. Clean and store equipment and supplies. Dispose of disposable items. Remove your gloves. Wash your hands. Then complete your finishing up steps as described in the final section of this video. In many facilities, urine drainage bags are routinely emptied and the urine measured at the end of each shift unless ordered otherwise. The urine drainage bag should also be emptied when it becomes full. When you empty urine drainage bags, it is important to remember the principles of standard precautions. Personal protective equipment will be needed because of potential contact with urine. To empty a urine drainage bag, begin by washing your hands. Then, gather your supplies. These include gloves, paper towels, alcohol wipes, and a device for measuring the urine, in most cases a graduate. To empty a urine drainage bag, begin by putting on your gloves. Then place a paper towel on the floor underneath the urine drainage bag. Position the graduate on the paper towel underneath the emptying spout. Unhook the emptying spout from its holder on the urine drainage bag. Unclamp the emptying spout on the urine drainage bag and allow all of the urine to drain into the graduate. Avoid touching the tip of the emptying spout with your hands or with the side of the graduate. After the urine has drained into the graduate, reclamp the tubing. Then clean the emptying spout with the alcohol wipe or according to your facility policy. Then return the emptying spout to its holder. If the person is on intake and output status, measure the urine. Note the color, amount, and quality before emptying the contents of the graduate into the toilet. Dispose of disposable items. Clean and store the equipment and supplies. Remove your gloves. Wash your hands. Then complete your finishing up steps as described in the final section of this video. While assisting a patient or resident with an indwelling catheter, be sure to notify the nurse if you observe any of the following: changes in the color, clarity, or odor of the urine, failure of urine to flow freely through the tubing, the person complains of pain or discomfort as a result of the catheter, redness, swelling, or discharge from the catheter insertion site, or leaking of urine around the catheter insertion site. Urine output is a key indicator of fluid balance. In a person who is maintaining a good fluid balance, urine output is neither too high nor too low. Evaluating a person's urine output is also a good way to determine how well a person's kidneys are working. That's why, when the measurement of a patient's or resident's urine output is called for by the person's care plan, it's important to make an accurate measurement. If you are required to measure a person's urine output, always remember to take the necessary standard precautions. Then determine what method you will use to measure the urine. The method you will use will vary according to what the person will use to void in. If the person has an indwelling urinary catheter, then measuring the urine output is simply a matter of comparing the level of urine in the bag to the measurement markings on the outside of the bag. For a patient or resident on intake and output status who voids into the toilet or bedside commode, you will need to make sure that a urine collection device, commonly called a commode hat, is in place on the toilet or commode before the person voids. Typically, commode hats have measurement markings that make it easy to accurately measure the person's urine output. If the person uses a urinal, it too, in most cases, will display accurate markings. If the person has voided into a bedpan, it is necessary to pour the contents into a graduate in order to obtain an accurate measurement. Place the urine-filled graduate on a counter to ensure that it's level, or carefully bring it to eye level to read the amount of output. Whichever method of measurement you use, be sure to record the amount in cubic centimeters or milliliters. Also, note the color, clarity, odor, and appearance of the urine. This information may be very valuable to the nurse. Often, when people are hospitalized or ill, they may experience incontinence, the inability to control their urine or feces. Incontinence can also happen as a normal part of the aging process. Incontinence is very embarrassing for most people. Never blame or ridicule a person for incontinence. Incontinence places the person at risk for developing skin problems such as rashes and pressure ulcers. Good skin care is the best way to prevent skin breakdown and injury. Measures include keeping the skin clean and dry. If the person is incontinent of urine, incontinence pads or briefs may be used to absorb urine and keep it away from the body. When using a garment to absorb moisture, do not refer to it as a diaper. This term is demeaning and offensive to many patients or residents. Use proper terms to describe the garments, such as briefs or pad. Check the person's skin and garments frequently. Remove soiled garments promptly, and provide perineal care. For men, a condom catheter is sometimes used. This external device is applied to the penis and connected to a drainage bag to allow urine to flow away from the skin. Here again, meticulous skin care is very important to ensure that no breakdown occurs. Often, incontinence is only temporary. Many people are able to regain the ability to control bowel and bladder functions through bowel or bladder training. You may be involved in helping your patients or residents with this training. Elements of bowel and bladder training are fairly standard, but the way this training is actually carried out may vary from facility to facility. Basic elements of bowel and bladder training include evaluating the person's elimination pattern, developing and following a toileting plan, periodically evaluating the person's progress, and consistency and practice. The person's care plan will reflect any special bowel or bladder training techniques that have been initiated, and the nurse will tell you about any specific duties you will have as part of the training. Remember, bowel and bladder training is based on the principles of consistency and practice. You can help your patients or residents to meet their goals by carefully following the toileting schedule that has been prescribed. Some patients or residents in your care may have undergone surgery to remove a portion of their intestine or bladder. These patients or residents will have a stoma, a surgically created outlet for feces or urine. The stoma is usually located on the person's abdomen, and the feces or urine are collected in a bag or pouch called an ostomy appliance. Although most people can care for and empty their own ostomy appliances, others may need your assistance with this task. To assist a person with ostomy care, begin by washing your hands. Then, gather your supplies. These include gloves, paper towels, a bed protector, toilet paper, 4x4 gauze pads, a clean ostomy appliance, a bedpan cover or paper towels, a wash basin, a bath thermometer, soap or another cleansing agent, washcloths, and a towel. Optional supplies include adhesive remover and deodorant for the ostomy appliance. You might also need a skin barrier. Cover the overbed table with paper towels, then put the supplies on the paper towels. The supplies you will need will vary somewhat according to the position of the stoma on the person's abdomen and the manufacturer of the ostomy pouch. Make sure you follow the directions for the particular product used by your facility on each individual patient or resident. Position the bed at a comfortable working height to promote good body mechanics. The ostomy appliance can be changed with the person sitting or standing in the bathroom, or while the person is in the bed. The procedure is easiest when the person is sitting upright or lying flat, as in this example. If necessary, lower the head of the bed so that it is flat as tolerated. Make sure the wheels are locked. If the side rails are in use, lower the side rail on the working side of the bed. The side rail on the opposite side of the bed should remain up. Fan fold the top linens to below the person's waist. Put on your gloves. Adjust the person's clothing as necessary to expose the stoma. Position the bed protector alongside the person to keep the bed linens dry. Then place the bedpan on the bed protector. Remove the ostomy appliance by holding the skin taut and gently pulling the appliance away, starting with the top edge. If the adhesive is making removal difficult, use warm water or adhesive solvent to soften the adhesive. Place the ostomy appliance in the bedpan. Gently wipe the stoma with toilet paper to remove any feces or drainage. Place the toilet paper in the bedpan. Cover the stoma with a gauze pad to absorb any drainage. Cover the bedpan with the bedpan cover or paper towels. If the side rails are in use, raise them before leaving the bedside. Take the bedpan and the wash basin to the bathroom. Note the color, amount, and quality of the feces before emptying the contents of the ostomy appliance and the bedpan into the toilet. If anything unusual is observed, do not empty the ostomy appliance until a nurse has had a chance to look at its contents. Dispose of the ostomy appliance in a facility-approved waste container. Remove your gloves and dispose of them in a facility-approved waste container. Wash your hands. Fill the wash basin with warm water, 110 to 115 degrees Fahrenheit. Return to the bedside and place the basin on the overbed table. If the side rails are in use, lower the side rail on the working side of the bed. Put on a clean pair of gloves. Form a mitt around your hand with one of the washcloths. Wet the mitt with warm, clean water and apply soap or other cleansing agent. Remove the gauze pad from the stoma and dispose of it in a facility-approved waste container. Clean the skin around the stoma. Rinse the skin around the stoma thoroughly. Then dry. Apply the skin barrier if needed and allow it to dry. Next, make sure the opening of the appliance that fits over the stoma is the correct size. Remove the adhesive backing on the ostomy appliance. Gently center the appliance over the stoma and press around the edges to seal the appliance to the skin. If you are planning to add deodorant, place it in the ostomy appliance at this time. Attach the pouch to the appliance, making sure that the drain is pointed downward. Remove the bed protector. Remove your gloves and dispose of them in a facility-approved waste container. Adjust the person's clothing as necessary to cover the appliance. If the bedding is wet or soiled, change the bed linens. Assist the person into a comfortable position. Straighten the bottom linens and draw the top linens over the person. Raise the head of the bed as tolerated. If the side rails are in use, return the side rail to the raised position. Gather any soiled linens and place them in the soiled linen hamper. Clean and store the equipment and supplies. Dispose of disposable items. Remove your gloves. Wash your hands. Then complete your finishing up steps as described in the final section of this video. When you have finished with a procedure, always follow a routine of finishing up to ensure your patient's or resident's safety and comfort. First, confirm comfort and good body alignment, whether the person is seated or in a bed. Leave the person's call light control within easy reach, and do the same for any other items the person may want, such as remote control devices, the telephone, or fresh water. Next, see to safety. If appropriate, return the bed to its lowest position. Then, make sure the wheels are locked for safety, and place the side rails in ordered or requested positions. If desired, open the curtain or door and ask whether the person would like for visitors to return. If you used gloves, first discard them according to your facility's policy. Then, wash your hands. Finally, report and record all pertinent information about the procedure, including the date and time of the procedure and your full name and title.